My name is Aoife Kerwin. I'm the Information Advocacy and Research Officer with MS Ireland, and we're absolutely delighted to be able to participate in this afternoon's event and tell you how we used the Atlas of MS data in the past and how excited we are to use the updated data. So in 2008 in Ireland, we only had 14 neurologists, and it was the lowest number of neurologists per 100,000 people in Europe. The Atlas of MS provided us with data that we used to compare Irish health provision with that of other countries. And this allowed us to highlight the gaps that existed and to communicate those issues to decision makers. And we recognized that the lack of neurologists was not an issue that was specific to the MS community, but it was something that was more broadly relevant to the neurology community. So MS Ireland collaborated with the Neurological Alliance of Ireland to highlight these issues. And we utilized the Atlas of MS data to inform the work and to communicate to decision makers. The issues that created challenges for people with MS and the wider neurology community. This included submissions to government and advocacy campaigns. And we are pleased to report that there was some success with this, and the government made a commitment to increase the number of neurologists. So since then, there's been a steady increase in numbers. So rising from 14 neurologists in 2008 to 37 neurologists, which is seen in the third edition. Sorry now. More recently, the Atlas of MS data was used to help design a research initiative last year, in which regional staffing, service staffing was explored. The data helped to identify gaps in what existed, what was recommended, and what was in place in other countries. And stemming from this, the National Clinical Programme for Neurology in Ireland identified a need for additional neurology posts. And in the winter plan, they applied for additional neurology posts and successfully secured 5. So despite the high prevalence of MS in Ireland, we still have a relatively low number of neurologists. The updated Atlas of MS still points to this being an issue. And while there's been a steady increase in the number, there is still progress to be made. We're thankful that the updated data will help us to identify and communicate some of the service gaps that exist, and to demonstrate where neurology services in Ireland are lacking. This will help us to highlight and address associated challenges for the MS community in Ireland. With the help of the latest edition, we look forward to building upon the successes that we have had in the past using previous data from previous editions and ensure that the MS community in Ireland are provided with adequate service provision. Thank you.